long of a pause we're anticipating for these frozen resources. It is very unclear at the moment. The administration says they need to do this comprehensive review of every single program to see how it matches up with the executive orders. That could take some time, but we're hoping that with enough pressure from Congress, they will unfreeze these funds and allow resources to move forward. I'm just going to see if there are other questions in the Q&A box. What is the best way to contact your representative? By phone or by email? You can see in the chat box our colleagues gave a link to a resource you can use, but you can also look them up on Google to see what number to call them at. I hear that they're hearing from a lot of constituents, and so you want your voice to be added in there too. William is asking whether or not rental assistance is protected. Is there a formal statement to that effect? Not formal enough, not explicit enough. So that's why we need to act with all urgency to make sure we're continuing to weigh in with Congress about the impact in the Section 8 program and other programs as well. I'm going to move on just in the interest of time to talk a little bit about those executive orders. As I mentioned, the Trump administration is comparing these programs with how they match up to the executive orders, so it's important that all of you know what are in these executive orders to begin with. So what we saw is that starting on day one of the administration, President Trump signed a number of executive actions, executive orders that, if implemented, would actually worsen our affordable housing crisis and make it harder to serve everybody who needs help. How would that happen? Next slide. Please. Thank you. Well, there was many executive actions, executive orders that were signed that would terminate all diversity, equity, inclusion, and accessibility practices and programs, including those at HUD, that rescinded previous guidance from the Trump administration about serving underserved communities. If that continues, it would make it very difficult for all of us to address historic and ongoing systemic racism in the housing market, to ensure there's a diverse workforce at HUD and at other federal agencies, to enforce the laws we have on the books to protect people in their fair housing and civil rights. And without a commitment from this administration to diversity, equity, and inclusion, it will be harder to address the housing crisis, which we know disproportionately impacts Black, Indigenous, and people of color. Next slide. There was also an executive order impacting HUD staff and other federal agency staff. Of course, we know that HUD staff are deeply committed to this work. They have deep subject matter expertise, and they're also under-resourced, understaffed, overworked. And so an executive order that instituted a hiring freeze will make it difficult to hire new staff so that they can help operate the programs that we have. It could slow down the agency's ability to help states and communities address their housing needs, and make it harder for the programs to be operated the way that they're intended to. Next slide. There was an executive order that denies fair housing and civil rights protections to transgender individuals and other LGBTQ people. It also directed HUD to rescind protections for transgender people who are experiencing homelessness and seeking shelter. And we know that if that continues, if HUD implements that executive action, it could lead to even more people experiencing homelessness, which is dangerous and puts lives at risk. Next slide. There was also an executive order threatening to withhold federal funding from sanctuary jurisdictions or jurisdictions that limit or deny cooperation with immigration officials. So those communities would not be eligible to receive federal investments, even though Congress provided that funding. If that executive order is used to deny access to federal housing, homelessness, and community development funds, of course, that would mean fewer resources for communities to help families purchase a home, to build more affordable rental housing, and to prevent homelessness. And then finally, another executive order I just wanted to call attention to is, next slide please, is one that rescinds guidance to allow immigration enforcement to go to sensitive areas to make arrests. And in doing so, it means that immigration law enforcement could target disaster relief centers, domestic violence shelters, homelessness shelters, creating a lot of fear among immigrant households, which may often include U.S. citizen children. At the same time, that will create a chilling effect where people will not seek assistance at the time where they might need assistance the most. I'm going to just pause there and turn briefly to see if there are any questions about these executive orders. I will say that many of them are directive to federal agencies to implement, so we will be monitoring them to see what actions HUD and other federal agencies take to implement these executive orders, but it does give you a very clear sense of where this administration might go. And that, in the interest of time, I'll go to the next topic, which is Scott Turner, who is President Trump's nominee to lead HUD. We got a sneak peek into what his priorities might be if he is confirmed to be HUD secretary. I will say that, next slide, please. There were some bright spots in his testimony about places where the National Income Housing Coalition could work with him to help address the housing crisis. He talked about reducing state and local barriers like zoning barriers and land use restrictions that drive up housing costs. He spoke about the need to permanently authorize HUD's long-term disaster recovery program. He talked about improving and streamlining federal housing programs, which is great. We're always open to those conversations, and ways to create more workforce opportunities for low-income communities and vigorously enforcing fair housing laws. I will say, next slide, that despite those bright spots, there were a number of concerning statements that he made during that confirmation hearing. He signaled that he would not commit to protecting funding from HUD, which now, as we see with the freeze on federal funding, is incredibly important that we have somebody who is HUD secretary who is defending these programs within the administration. So that is deeply concerning. He advocated for increasing the role of private equity in the rental market, despite the very poor track record of private equity firms in terms of raising rents, imposing junk fees, evicting tenants, failing to maintain properties. And he very clearly opposed HUD's efforts to advance equity, saying that it's holding grantees hostage. He blamed immigrants for our nation's housing crisis and endorsed new barriers to assistance, including work requirements, which often leave people without the assistance they need in order to maintain their work. Next slide, please. Okay. So despite what was happening in that confirmation hearing, I encourage you all to check it out if you have a chance. There were a lot of things that were unsaid in that confirmation hearing that we still expect the administration to move forward on. We expect them this year to propose deep spending cuts through the budget resolution process. We expect them to propose work requirements, time limits, rent increases on HUD households. We expect them to move to evict or force mixed status immigrant families, so families that might include a U.S. citizen and somebody who's ineligible based on their immigration status, to force those families to break up or to face eviction, and to divert money away from proven solutions to homelessness towards ones that are ineffective, costly, and outdated. So we expect those and a lot more to come down the pike soon. We are very closely monitoring that situation, and we will keep all of you directly in the loop about how you can engage on it. Before I move on, I just want to say there is one place where you can take action today, and that is with the federal freeze on funding. This is an issue that I encourage you to reach out to your senators and representatives today, and again, every day that federal funding is frozen. And with that, to help keep us on track, I am going to move along to our next speakers, who are going to share a little bit more about the threats that we see ahead to Medicaid programs. I'll turn it over to you, Kim, to get us started.
Thanks so much, Sarah, and hi, everyone. I'm Kim Johnson. I'm the policy manager here at NLIHC, and before I turn it over to my colleagues, Anna and Yolanda, I wanted to provide a quick primer on budget reconciliation and what it is, just top line stuff to know for the purposes of this conversation. And then my colleagues who are much more learned than me at the intersection of Medicaid and homelessness are going to take over. So next slide, please. So Jen, again, just for a very, very quick overview, budget reconciliation is a legislative process that allows Congress to move fiscal legislation specifically pretty quickly. And I say quickly relative to the speed at which Congress usually moves. And they do this through a few different mechanisms. One, budget reconciliation allows Congress to avoid the Senate filibuster rule. So that means they only need 51 votes for a bill to pass the Senate rather than the 60 that are usually required. The reconciliation process also limits the scope of amendments that can be added to a bill, and it limits the debate time on a bill. So it all goes by a little bit more quickly than kind of the traditional budget process. Next slide, please. Thank you. The flip side of budget reconciliation is that there is a limit to what can be included in a reconciliation package. So it basically has to impact federal spending or revenues, or it can address the debt limit. So when we talk about revenues, we're talking about taxes. For this reconciliation package in particular, because Republicans control a majority in the House, the Senate, and the White House, of course, that means that they can pass a bill through this process without any input from Democrats. So it can be a totally GOP sponsored bill. So they're looking at this reconciliation bill as an opportunity to pass some tax cuts, to continue tax cuts from the Tax Cuts and Jobs Act that was passed back in 2017. And they can also use the bill to impact spending, and that includes mandatory spending like Medicare, Medicaid, and SNAP, but not explicitly not Social Security, and historically not discretionary spending like programs for HUD. I think that might be it for me. Next slide. Oh, I have one more, sorry. So why are we talking about all of this? So again, Republicans are considering one or potentially two reconciliation bills this year that could make major cuts to vital anti-poverty programs, including Medicaid. And if enacted, those cuts would have a significant impact on people with low incomes, including the people, of course, that NLIHC serves. So even though looking at the reconciliation package, there's nothing explicitly on housing right now, we want to make sure that we're supporting our partners and making sure that these crucial programs are kept safe and people are still able to access the resources that they need. And so with that, I am now going to turn it on over to Anna and Yolanda to take it away.
Thank you so much, Kim. Hi, everybody. My name is Anna Bailey. My pronouns are she, her. I'm a senior policy analyst at the Center on Budget and Policy Priorities. I'm going to kick us off on this part of the conversation. But before I get going, I want everybody, I'm seeing a lot of anger and rage, very justified in the chat. I want to say that that is an appropriate response to the policies that Sarah outlined earlier. And I feel really honored to be on this call with over 1,000 people who are all committed to helping to stop these harmful policies and work together to build towards a future where everyone has the stable housing and healthcare that they need. So I appreciate everybody's outrage. I think that we can leverage that anger. And before jumping into the reconciliation and healthcare cuts conversation, I saw a lot of questions in the chat earlier about whether or not the federal funding freeze affects Medicaid. So quickly, I want to answer that. There have been reports that state Medicaid agencies are not able to access the portal that they use to get federal Medicaid funding. But some of the communications from OMB and the White House has specifically said in the last few hours that Medicaid is not included in the freeze. So some mixed messages there. Hopefully they will rectify the portal issue soon, but we're staying on high alert. We're definitely staying on high alert. So shifting to the Medicaid threats, everyone. So I want to start off, if you can go to the next slide, and give you a sense for what we're going to try and cover today, that Yolanda and I are going to cover. So if you go to the next slide again, I'm going to start us off with just a little refresher on Medicaid, some Medicaid 101, so that you can understand the nature of the legislative threats and reconciliation that we're facing. And I'll give an overview of those threats, and then I'm going to pass it to Yolanda to help us unpack what this means for housing security and homelessness, and how specifically y'all can get involved to help and stop these potential threats. If you go to the next slide. So, right, Medicaid is a big program. It's a state-federal partnership. And so it covers over 70 million people in this country. So that's a whole lot of humans that rely on Medicaid to access healthcare. And by federal-state partnership, I mean that every state runs its own Medicaid program. It does so within federal guidelines, but they have a lot of flexibility to decide who they're going to cover, what the eligibility is, as well as the kind of benefits that they're going to cover. So there are sort of minimum levels of eligibility and benefits that they have to cover, but there are options that states have. This is going to make a lot more sense why I'm talking about this when we get into the impact of the cuts, right? But states, while there's some benefits that they absolutely have to cover, there's a whole lot of benefits that they can dial up or down, decide. For example, when it comes to mental health and substance use treatment, if they want to cover a really rich set of services, or maybe a more skimpy plan for substance use and mental health care, and who can access those services, as well as how much providers get paid for the services that they provide. There's also housing-related services that states can decide to cover or not. I know Nicole later on is going to talk about a specific state example of what states are doing around that, so I'll let her talk about that more. Again, everybody, you will have these slides to reference, so I'm not going to read every word for you. If you go to the next slide, the financing, how Medicaid is financed, is another big part of that state-federal partnership, and is really what makes Medicaid Medicaid and makes it a special program. So states and federal government both share in the costs, but the federal government, as you can see on this slide with the yellow portion here on the chart, the federal government's paying for the majority of Medicaid costs. Right now, when it comes to the expansion population, the federal government is picking up 90% of the costs, so states are only covering 10%. And for all the other, the rest of the Medicaid population, the federal share varies between 50 and 77%. That's based on a formula that varies by state. So anything that messes with how Medicaid is financed is a really big deal, not only for the folks who receive Medicaid and rely on Medicaid, but also for state budgets, because Medicaid is the single largest source of federal funding in state budgets. So it has a broader impact on state budgets. So next, I'm going to give you a high-level overview of the kinds of legislative threats that we're expecting or that are being considered as a part of the budget reconciliation process that Kim was talking about earlier. All of these 4 different buckets function as cuts to the Medicaid program. So one form it could come in is a block grant or a per capita cap that basically caps the amount of the federal share, the federal funding going to support Medicaid. And that would be a radical change in the Medicaid program. And it would make it a lot harder for states and the federal government to make sure people have access to care during emergencies. Like if we have another public health crisis and healthcare spending needs to go up, that cap on federal spending means it would be up to states to pick up the extra cost if spending was more than expected. Similarly, Medicaid enrollment usually increases during recessions when people lose their health coverage tied to their jobs. And so if we were to see another recession under a block grant or per capita cap, there wouldn't be an automatic increase in federal funds to support that. The cost would be shifted to the states. Work requirements are another form of cuts. Everyone needs and deserves health care, period, end of story. And taking coverage away from people because they aren't able to find work or they can't meet the burdensome documentation requirements related to a work requirement. We already know from experience that that just takes coverage away from people and makes it harder for them to get health care at times when they're struggling the most. Another form of cuts we could see is changing that federal share. So FMAP is just the federal portion of Medicaid spending. So we're hearing threats of reducing the federal percentage, either for the expansion population or for everyone else outside of the expansion population. That again shifts costs onto the states and puts them in a position to make hard decisions about how they're going to fill that gap, or more likely how they're going to cut benefits and eligibility in order to reduce their costs. Finally, there are talks about eliminating a really important source of funding that states use to pay for their share of the Medicaid spending, called provider taxes. So often this is taxes on for-profit hospitals or managed care organizations, and almost every single state uses some form of provider taxes. And so again, eliminating or reducing that revenue source for states puts them in the position to either find another way to raise that money, which is really hard for most state budgets, or to look at how to reduce their costs in the Medicaid program by reducing enrollment, so kicking people off of the program, or cutting benefits that people really need and rely on to get their needs met. So the next several slides I'm going to touch on very briefly because they're really just resources for you all to have after this presentation. I don't have enough time to read every word on here, but this particular graphic here helps you see how a block grant or per capita cap goes from, in the top portion, you can see that if Medicaid costs increase because of a recession or a public health emergency or some other reason, the federal government and state governments share in that cost. But under a per capita cap, it's the state that takes up, that has to pick up all of that cost. Next slide.
Just don't stop short on purpose.
When it comes to work requirements,
Short on purpose.
we don't know exactly what kind of a work requirement proposal we could see. There has been a talk of applying work requirements to every state program across the board, and this map shows you what percentage of folks in each state would be at risk of losing their coverage, if that were to happen. We're talking about 36 million adults who could potentially be at risk of losing health coverage if they weren't able to meet a work requirement. Next slide. And for reference in the future, this slide helps outline the two different ways that we're hearing discussed of ways that policymakers could reduce the federal matching rate for the expansion population or for everyone else. And depending on which way they go, different states will be most impacted. And so this slide kind of outlines some of that. And there are links on a lot of these slides where you can get more detailed information. Next slide. And I think I already covered this about the provider taxes that states rely on to fund Medicaid, that reducing those sort of puts states in a position of having to cut benefits or eligibility or provider rates, for example, to make up for the reduced level of funding that they have available to contribute. Next slide. All right, so at this point, I gave you an overview of the different kinds of cuts that we could see that are being discussed. I'm going to pass it on to Yolanda to help us understand what does this actually mean in the world? How does this trickle down to people's access to care and ultimately their housing security, and affect people's risk of homelessness? So I'll pause there and hand it to you, Yolanda.
Hi, everyone. Thank you so much for taking time out of your schedule to be with us and hear more about the executive orders and the potential impacts that it has on our community. I want to take a little time. Anna did a really nice job of setting the context, and I want to take a moment to speak to the housing and homeless providers by just saying, listen, we know at the Alliance that you are dedicated to meeting the needs of all people experiencing homelessness who seek services from you. And we know that these executive orders really, if implemented, could really undermine your work and certainly adversely impact our population. And we also recognize that it is creating a significant emotional strain. We want to just acknowledge that and also to encourage you to continue to provide the evidence-based, client-centered work that you do on a day-to-day basis, regardless of all the noise that you're hearing right now that you've been carrying out throughout this time. And also just to say, as a reminder, chaos and shock and awe is really meant to distract us. But we know about being distracted, and we will not let that deter us from being the anchors for those who are unhoused. Okay, so let's get into this. What does this mean? What's the impact? When we talk about the scaling back eligibility, you may recall that with Medicaid expansion, the enrollment rolls for Medicaid really increased significantly. And when we talk about scaling back eligibility, we mean that in many cases, those individuals who were eligible based on Medicaid expansion will no longer probably be eligible. And this is, when we're talking about previously groups that were adults who did not meet the poverty level, right, of income. They were not eligible, but Medicaid expansion made them eligible. And then we're talking about further groups. I think Anna talked about work requirements. So we know that that's going to impact enrollment. Really, all these cuts are geared towards enrollment, right? And so when we look at that, the work requirements, it's not that people who are unhoused do not work. It is that they may not be able to meet all the reporting requirements to document their work. They may not have access to the computer system or forms to be able to complete and send to their Medicaid agencies. So that's what we're talking about in that case, about scaling back eligibility. When we look at reducing benefits, we're talking about, remember, there's mandatory benefits and services, and then there's discretionary services. So mandatory hospital visits, physician visits, etc., those types of things, home health care, long-term care. We talk about discretionary, we're talking about dental, vision. You can imagine to see those types of benefits being cut. You can also imagine that there will be caps on benefits, right? So whereas before you could have all of these types of benefits without this type of cap, they're going to reduce that, right? And when we talk about cost sharing, those are the premiums, that's co-pays, that's deductibles. So you can see that those things will raise, those costs will raise. And when we talk about the reduction in provider payments, now remember, this is generally seen as a short-term cost-saving measure, but it has certainly some long-term impacts on quality and access to healthcare services. And further can worsen the current shortage that we're seeing in the healthcare system. Well, all over in health and human services, we see these shortages in the workforce. We will certainly see that if these types of cuts are implemented. All right, so let's move on to the next slide. So this slide is really talking about Medicaid. We know it's a safety net program. We already know the relationship between housing and health. And this slide helps to demonstrate the impact that healthcare has on those states that had expansion or non-expansion. And I think that Anna had a slide that showed you those states that were non-expansion states. And I think the thing for us to consider and think about here is there are states that have trigger laws that say, hey, once this FMAP changes, guess what? We're out. We're out the door. We're not going to continue our expansion because the feds have basically said, this is your budget. These are your costs. And so you will see those states choosing, I think there was a question in the chat, choosing not to continue their expansion plans or to revert back to just standard Medicaid. All right, next slide, please. So this slide just happens to tell you that when people have health insurance, they are more likely to have housing stability, right? Because we know that when you have health care coverage, it helps with your financial stability in a sense that you will not have to cover all of those costs when you have limited income. All right, next slide, please. All right, so this is I think the part of the work that we're talking about. What actions can I take? We heard all of the information that can really be exhausting and emotionally triggering to walk through. But let's focus on what can we do. Number one, reach out. I think Sarah and Anna both talked about contacting your members of Congress, contacting your state legislators, their local offices as well as their offices in DC. Reach out to your governors, right? Because the last thing your governors need is to have these expenses, Medicaid, total responsibility for that, right? Or a higher level of responsibility than they had in the past. Especially in my state, Virginia, where we have to have a balanced budget at the end of each. So this is not something that they necessarily would support. Fingers crossed. The other part that I would say is if you don't know your Medicaid director in your state, hello, go and introduce yourselves to them, because I think this is a prime opportunity to partner and to demonstrate to them how you can work together to advocate for your clients, and certainly for being able to explain to them, which they already know, how when we have health coverage, we have a reduction in costs like emergency room costs, etc. The other thing that I would say is waivers. We didn't really talk about Medicaid waivers. I think Anna talked a little bit about it in one slide when she talked about health-related needs. In this case, someone asked about, hey, what's going to happen to those Medicaid waivers that are maybe in the pipeline? We don't know what will happen in those cases. Remember that it's at the discretion of the HHS secretary as to whether waivers will continue or not. So I think that's something else to think about. And you see in this slide, it talks about engage your media and partners, having those stories shared not only with media, but even when you're reaching out to your legislators to share with them, here is the impact. I think those are very important points to carry. And I think as Sarah talked about some of the immigration and things like that, I think it's important for you to look at those types of organizations that are really here advocating as it relates to looking at the legality, the merits of some of these executive orders. So I think when you talk about looking at the National Housing Law Project, when you look at if you're working with older adults, Justice and Aging, or the National Center on Law and Elder Rights, NICLR. I think looking at those organizations, seeing what information they have so that you can strategize and plan on how you will put forth action to help to mitigate, but certainly to advocate. All right, next slide, please. All right, here are the key messages. You're talking about the impact. You're talking about the impact not only on your clients, but on your workforce. You're talking about why it is important to have Medicaid and not to have it necessarily the way that is being presented by this administration. I think those are the things we want to keep going. Please do not become dismayed. Hand off things to other people so you are not the only one scrolling and reviewing all the information that's coming towards you. Take time to be strategic in how you plan and strategize. All right, Sarah, I see you've come on, so I will turn it on to the next person.
Well, if you could just stay on and on it too, I just want to ask a couple of questions from the audience. One, this is such great information. It gives us a really good sense of what could be coming down the road. In terms of timing, when do you think we might see these proposals to cut back on Medicaid? What's the timing for that?
Great question, Sarah. So there's still, like Kim was saying, there's still some uncertainty about exactly which route they're going to take in the reconciliation process. We should know more in the coming weeks. As early as next week, we're hearing in early February, the House might vote and introduce a budget resolution that could give us a better sense of what they're thinking of cutting. But that will be very high level, so it won't give us all the information we need. What I would say is that the time to act is actually right now, because the goal is for Medicaid to not be considered as on the table, right? That actually Medicaid cuts shouldn't even be part of the conversation because of the harm that they would have to our communities and to our states and to the people that we're serving and all of our missions. So even though it's not super clear how the process is going to play out, we do know that they're going to try to push it as fast as possible. And so like I said, the time to act and to reach out to stakeholders and lawmakers is now. And we will be keeping really close watch in the coming weeks as we get more information. But Medicaid has been on lists that have been leaked, so we know it's a part of the conversation.
And I would just add that this gives us a look into their playbook, right? So even if some of this doesn't happen this, term, this congressional session, think in mind and be strategic and plan so that you can mitigate this in the future. And remember, we're going to have midterm elections. So start to educate yourself, educate your clients about what's going on, because this can really be disarming for them as well. And so helping them to understand what's going on, I think is also an important part of it. And if you're not signed up for alerts from the different organizations represented here, I would suggest that you sign up for those action alerts so that you can get this information more timely.
Yeah, thank you for that. And I think earlier on the call, we mentioned that the budget reconciliation process is one that would allow Republicans to pass this bill in the Senate with only 50 votes instead of the usual 60 votes, which means that they can do it without any Democratic senators' support. So if you happen to have a Republican senator or governor or House member, you can have the biggest impact in terms of pushing back on this proposal. It's important for all members of Congress to hear about what these threats mean. But if you happen to have a Republican member of Congress or governor, they have a particular power in this negotiation to make a difference and to make sure that we're protecting Medicaid. So with that, I want to thank Yolanda and Anna for joining us. I hope you'll join us again in the coming weeks as we learn about more threats. And then we're going to turn it over to our last speaker, Nicole Newhouse from Arizona Housing Coalition, who's going to talk a little bit about how she's used Medicaid resources to serve people experiencing homelessness. But before I do, I just wanted to note my colleagues mentioned that already we've had 4,300 people send messages to their members of Congress about the federal freeze of resources, the freeze on federal resources. You guys all here and elsewhere have the power to protect these programs and protect resources, protect the families that rely on these resources. I'm already impressed. One day of action, 4,300 actions have taken place. So kudos to all of you. Keep up the pressure. And with that, I'm going to turn it over to Nicole, who can share a little bit more about the great work that she's doing and how Medicaid plays a role.
Great. Thank you so much, Sarah, and good to be here with everybody. I don't know if you guys have my slide deck. If not, I can just talk, and I noticed the comment. I will try to talk a little bit more slowly. Thank you. So I'm Nicole Newhouse. I'm the Executive Director of the Arizona Housing Coalition, and I'm going to talk a little bit about the potential impacts of cuts to both Medicaid and TANF, as well as the impact of the freeze within the state of Arizona. Next slide, please. We here in the state of Arizona have a little over 2 million individuals who are enrolled in Medicaid. Our eligibility requirements are that you are an Arizona resident, you're a U.S. citizen, and then there are varying income limits for different populations, be you a pregnant woman, children, adults, elderly with disabled, and it's all varied based on federal poverty levels. There are some work or community engagement, and obviously the potential impact to eligibility, if there are cuts made, is they could lower the income threshold, they could reduce the coverage for specific populations, they could create wait lists. There are a number of covered services. They're pretty basic: medical care, hospital services, prescriptions. We do enjoy behavioral health, including mental health, counseling, and treatment for substance use disorder here in the state. And our long-term care provides nursing home care and community, home and community-based services, along with dental. So that's about 21% of our population that is covered, that's enrolled. What's interesting is that 30%, if you move to the next slide, of our population is considered low income. So 21% enrolled, 30% of our population is considered low income. If we go to the next slide, 70% of the non-elderly enrollees are people of color, really demonstrating that our Medicaid program here in the state of Arizona provides support to a diverse number of individuals. If we can advance to the next slide. 65% of the cost of the 65%, the federal government covers those costs for us here in the state of Arizona. So again, if Medicaid is cut through the reconciliation process, we might expect a decrease in enrollment or a limiting of services, which would impact over 2 million vulnerable Arizonans. In addition, there could be some economic impact. Medicaid cuts could strain healthcare providers, especially in rural areas, and lead to higher uncompensated care costs. And I know that there has been some resolution to the ambiguity surrounding the scope of the OMB's directive, but it has led to some confusion about which programs are impacted, which I think I've seen throughout the chats. In our state, state agencies are facing challenges to understand what funds and programs will be impacted due to the federal pause, which could lead to delays. Now, one of the interesting things here in the state of Arizona is we have a pilot program going on through Medicaid. It's called the Arizona H2O program, Housing to Outcomes. And that's a state initiative designed to address homelessness by integrating housing and healthcare. The program focuses on leveraging Medicaid funding to provide supportive housing for individuals who are experiencing homelessness, particularly those with complex medical or behavioral health needs. They offer it's going to be offering stable housing combined with access to health care. So the potential impact is we might not be able to do what we expect to be really good work with this pilot if it's cut. And I think the previous speakers have talked through how that could impact populations as a whole. So I'm going to pop really quickly into TANF, if we could go to the next slide. In the state of Arizona, we only spend 9% of our TANF funds on basic assistance. That ranks Arizona as the 35th among the states in Washington, D.C. for percentage spent on basic assistance. In Arizona, we have some of the most restrictive TANF eligibility requirements in the country, with extremely low incomes to qualify and a 12-month limit, which is far below the national 60-month limit. A high percentage of our TANF dollars go to child welfare, 73% of it, as compared to the national average of 19%. And one of the reasons, and there's a lot of reasons for this disproportionate amount being earmarked for child welfare, is we have one of the highest rates of child removals. And we have historically underfunded the child welfare services from the general fund, which shifts the burden to TANF for things like case management, foster and adoption services, programs aimed at preventing child abuse and neglect. So any cut to TANF is going to definitely impact the very little that we have for basic assistance and really impair what we do across making sure that individuals have the support that they need. Next slide. So what this is kind of our whole system in the state of Arizona. Cuts in Medicare and TANF is going to impact prevention efforts as well as wraparound services in our homelessness response system like behavioral health and substance use disorder. Freezing financial assistance programs per the OMB memo will impact almost every element of what we're doing to meet the moment with our growing homelessness and affordable housing crisis. Next slide. Trying to honor time. So I think it's been addressed by everybody that has spoken before, but what we need to do and what we are doing here in the state of Arizona is advocating. And what we're doing with great intentionality, both here at the State House, because the majority is Republican, as well as with our federal efforts, is we're really being mindful to reflect on our rhetoric and our emotional reaction. I think someone shared earlier, I think it was Anna, that we are all having really big feelings right now, and all feelings are valid. One of the things that we're trying to do is give ourselves space to feel the feel, and then when reaching out to our lawmakers, making sure we're through those feels so that we can meet them where they're at, understand where they're coming from, as well as explain what we need to do in order to ensure that our communities remain are scaffolded to stability. I don't know that any of us could say that any of our communities are stable at this point, but we need this ongoing funding to ensure that we're continuing to scaffold our most vulnerable community members to a place of stability. So with that, I would say thank you and field any questions anybody might have.
Thank you so much for that, Nicole. That was a really good grounding us in the emotional reality of where we are too, not just the nuts and bolts on paper and what legislative proposals are being discussed. I don't see any questions right now, but thank you so much for joining with us. And for everybody who joined today's call, I know it was a lot of information. We are continuing to closely monitor all of the threats to Medicaid and to the federal freeze of resources. As I mentioned earlier, already we've seen 4,300 people take action to contact their members of Congress. So make sure that you reach out to them today and every day that the federal freeze is in place. And we will be in touch with you soon with more information and more resources. So everybody take care and talk to you soon. Thank you.